Hi everyone, Dr. Nemechek here. Time for another symptoms that are common but that are not normal. All right, today we're going to talk about certain foods triggering some digestive symptoms. So, common like tomato sauce or coffee or sometimes wine or, peppers give me reflux, or they give me diarrhea or something like that. But you can eat other foods, no problem. All right? Common, not normal, not healthy. Typically, this is a sign that you have SIBO, small intestinal bacterial overgrowth. And if you take, just for intestinal symptoms, if you take some inulin, which is a prebiotic fiber that can balance your gut bacteria, that'll stop. If you take 10 days of rifaximin, is the antibiotic that can safely balance your gut bacteria, stops. Okay? Why do you care? People say, well, I just take Prilosec. It's not a big deal. Because if you have SIBO, what that means is you have a lot of inflammation from this. Okay? Sure, it's not a big deal if Prilosec blocks it, but you still get the inflammation, and that could trigger over time diabetes, heart disease, chronic kidney problems, cancer, chronic depression, anxiety, osteoporosis, all sorts of stuff. That's why it's a problem. Okay? Anything that reflects SIBO is a problem for your overall health, but it can go away very quickly. I got a whole bunch of other videos on this. Check it out. If your GI docs won't take care of it, head on out here. We'll get it knocked out, and you'll be in good shape. That's all for today. Everybody, take care of your kids, yourself. Keep your inflammation down. Till next time, this is Dr. Nemechek. Have a nice evening.